All right. Good morning, everyone. I want to welcome us to another of my video. We're talking today on understanding and satisfying the adolescent patient. This webinar is for all those who come across adolescents in their practice. Could be school nurses, could be family physicians, community physicians, even the parents of our beautiful adolescents. Now, adolescence is the phase of life between the age 10 and 19, and they are often neglected because people do not consider them as children and don't consider them as adults at the same time. Therefore, their genuine health challenges are often dismissed. Adolescents undergo several developmental changes, and these ranges from pubertal, there are some body changes in the reproductive system, to physical, to intellectual, and emotional. With these changes, the adolescent seems to be, to the practitioner, as a complex individual that may not be understood properly, and because of that, may not be given the appropriate care. Now, who is the adolescent patient? I've tried to put down some of the attributes of the adolescent patient. They are minors under the age of 19, 18, as the case may be. Most times they are sick and under stress. That is the age, or this is the period of life that they are undergoing their academic work. And most times they're under academic stress. They are also more underlying factors to illnesses than merely the physiological, pathological, or environmental. We will need to consider their psychological and sociocultural context in addressing their challenges. Adolescents are reluctant to access care till situation gets very bad. And some of them also are malingerers, in the sense that they need attention, they want to escape duty, and also they want to avoid work. And so if you find an adolescent in a school clinic, for an example, that adolescent may be trying to be truant or to miss class, and therefore may pick or put up some IELTS presentations, illness presentations that might not be real. Adolescents are willing to relinquish their privacy when they become seriously ill. But on a normal day, they wouldn't want to expose their bodies for any kind of examination. They are at the risk of exploitation, medication errors, and stigma. And what they need from any practitioner that will take care of their emotional, psychological, and health need will be a whole person service. Do not just look at them as someone needing physical care. You have to look at the full context: psychological, intellectual, pathological, environmental, sociocultural, to give them a whole person care. And that's actually what adolescents want. Now, under these circumstances, adolescent patients can be far more emotional, demanding, sensitive, irritable, and uncooperative because of the factors highlighted above. Therefore, healthcare providers have the duty to understand the adolescent patient in this perspective in order to render good services. Now, there are some psychosocial attributes of the adolescent patient. The adolescent is actually bedeviled with what I call identity crisis. The question of who am I? The question of what am I here for? That the adolescent patient struggles with those kinds of questions. There is also independence craving in the sense that they want to be somehow free from the control of their parents. So nobody should talk to me. Why should I be counseled? Why should you tell me that this thing I'm doing is not good? They want to live in a world of theirs, yet they still want the care of superiors. So adolescents also struggle with what we call image concerns. How slim am I? If their ideal body image is being slim, they struggle with any kind of putting on of weight. So a fat adolescent wants to become slim, and a slim adolescent wants to gain weight. They are in that kind of challenge, or what I call confusion. Adolescents also have what we call intimacy confusion. How close should I be to the opposite gender? How close should I be to my friends? There's also inquisitiveness. 5, due to cluelessness. They're wondering, what is this about? They want to find out. They are clueless, so they want to find out, and they adventure. And that such curiosity can actually lead to some forms of addictions and some forms of challenges. There is also what we call instability in their choices and moods. Today they are high emotionally. Tomorrow they are low. There is some form of fluctuation in their moods. Today he wants to be a medical doctor. Tomorrow he wants to do something else. Anywhere that their friends gravitate towards, they tend to follow suit. Instability in choices. There is also what we call the lack of impulse control. They are moved by impulse. Today, they can just pick up their phones, pick up their boots, and they've left the house. Pick up their bicycles and their helmets, and they've left the house under the slightest impulse. They lack impulse control, and somehow their impulses control them. And in some adolescents, you have what we call inferiority complex that could lead to isolationism. In others, we have what we call incredible courage. Then adolescents also have increased chance for secrecy. You shouldn't know what's going on in their lives. And there is what we call increased risk-taking also. We cannot afford to be insensitive caregivers. Therefore, we must understand the adolescent's expectations. Now, there are some general expectations adolescent patients have when they come to the clinic, the school clinic, the family clinic. They want to be listened to. They want to receive clear explanation and instructions about their health condition. They want to be treated with care, concern, and compassion. They want to be treated by staff who are professional in their work, not people who report them to their parents, not people who breach the ethic of confidentiality. There are also some unrealistic expectations that adolescents have. Most adolescents want to discuss several major problems all in one standard consultation. That's not possible. Nobody can offer that. Also, another unrealistic expectation is to get well immediately after one dose of medication. They don't want to comply with medications. I'm going to finish 6 tablets. And when they get better after the first, second dose, they don't want to continue to come back to the school clinic to complete their medications. They also want to get the attention of the healthcare provider anytime, any day. This is another unrealistic expectation. So, how do we address the adolescent patients' unrealistic expectations? One thing you can do as a practitioner is to wisely implore them to cooperate with you, especially when the clinic is busy and as you will not have all the time to spend with them. So they should open up. But another thing you can do is not to allow them to irritate you with their actions, their silence, their uncooperative attitude. You need to explain to them why they need to complete their medications. Never display surprise at any information that they are involved, and be not judgmental or critical. Assess deeper why certain statements are made. Don't dismiss any verbal or non-verbal cues. Then, should you not be able to help them? Should it be you are not able to help and assist them? Or they are not willing to cooperate with you? To assist them for that, you could refer to another physician or practitioner for care. To satisfy the adolescent patient's expectations in the clinic setting, what can you do? Let there be eye contact. Smile at them. Should have noted their names on their folders. Call them by their names. Express words of consent. And by doing that, you break the ice and you can penetrate, get more details. Show courtesy. Let there be kind gestures and polite words. Listen. Let me repeat that. Listen again. Encourage adolescent patients to tell you their problem. Invite their questions and answer their questions. Inform and explain. People are less anxious when they know what's happening. And when people understand better, they are more cooperative and compliant with medication and treatments. So once again, inform them. Your condition is such and such. This is what it means. This is what is required to be done. This is what I want you to do. This is what I will do. Let everything be made clear to them. See beyond the illness. See the whole person. Don't refer to an adolescent by his health condition. That's sickler. No. That's sickle cell. No. It's demeaning. It shouldn't be done. Pay undivided attention. Reduce distractions and interruptions when dealing with adolescents. Else, the tuner. Secure their confidentiality and privacy. Watch what, where, and to whom you talk about the adolescent patient. Preserve their dignity. All that means is treat them with so much respect. They are not less humans. They are as adults are, and they are as children as children are. So treat them with respect and don't ever use any body shaming remarks. There should be nothing like that fat girl. No. That's albino girl. No, it shouldn't come out of a practitioner's lips. Remember the patient's family? That's a context. And so always refer to their family. Make their family members come around them. It gives them some form of protection and it grants them, this kind of assurance that they are safe. And should you have reasons to delay an adolescent, apologize for delay it. When you satisfy the adolescent patient, you gain patient loyalty. It improves patient compliance with treatment therapies, medications. There will be reduced risk of malpractice suits. There is increase in personal professional satisfaction because satisfied patients make us happier. The happier we are, the happier the patient should be. It increases staff morale and leads to productivity. In conclusion, let me say that school health facilities and family clinics that offer health services to adolescents must provide enabling conditions for quality care, provision, and constantly evaluate the services for patient satisfaction. Suggestion boxes can be placed at points. Feedback should be received. And healthcare providers must consciously work on our skills and work ethics to ensure provision of quality care and attention for adolescents, because a satisfied adolescent patient will recover faster with no relapses. Go into the chat box or the comment section and let's discuss our limitations to opening this ideal concept. Don't forget to subscribe on this channel, like it, and share it. Thank you.